for hosting us here, for the great work that you are doing. And the mayor presented all the data, you have the graph in front of us, but I just want to tell you a little story when I met the mayor. The same way that he was specifically talking about data, the rates, and the prevalence, and the incidence rate, and how it was affecting the different communities, was the way that he was talking to me when we met. So this is not for show. In that meeting, he didn't have any papers in front of him. He just came up with a lot of the data and the commitment that he had with this disease. And the same thing when he talks about infant mortality and when he talks about the issues affecting the district. I really want to applaud the mayor, and I also want to give thanks to the deputy mayor for all the work that she has done. I also want to thank the commission. This is something that has been done by community and the government of DC. And I want to give accolades because I used to be the senior most highest public health officer in the nation. And for me to see a decrease in 46% in an incidence of HIV, this is something that the nation has to know. Because what we're talking right now, that the models that are being used in DC, we can actually help other jurisdictions in our nation and the world. This is something that is real. This is not just gimmick of the data. I mean, maybe if I can move here for a second. Some people will ask, well, how do you know that this is not that people move out of this district or not? It's very simple. The prevalence, like the mayor mentioned, continues to be a little higher. Why? Because the people are living longer. But if you count the death in the bars and the incidence, it's the delta that you see here. So that means that we have less disease, and at the same time people are living longer right now. And the reason for that is we are getting them earlier, like the mayor presented before. We are getting them into programs, into adherence, and we're getting them into the community event. This is a chronic disease now. So you're going to see that not only we had to deal like it was in the 80s. I remember my first case that I had to deal was 1986. And when you see that, now you know that our programs are not only aimed for the acute cases, it's for the chronic process for HIV. The same thing with the children. The mayor did not mention for this past, the year 2011, we had no kids born with HIV. And that's a great success story right there. I also want to thank Michael Carfen, because right now he's serving as the interim senior deputy director for HASTA. He has come with a lot of energy, very dynamic. He's looking at the processes. He wants the community to be part of the equation very proactively. And again, the mayor knows if you give me a microphone, I keep talking a lot. So this is I think, the success of the district. I think this is the capital of the world, the capital of our nation. And it's good that when you see a 46 decrease, but the story that the mayor mentioned, the 80% decrease from IV drug use. 80%, that's like, you don't even put that into a plan of action because you will not expect such a decrease. So I just want to congratulate the commission and everybody that worked at the agency. This has been an amazing 5 years that you have been working in this more, but this is showing that what you guys are doing is really working. And again, the mayor for his leadership and keeping our district healthier. And Mayor, if you allow me, I would like Michael to say a couple of words on some of the initiatives that we have. He's going to mention about this web-based data system that we're going to put there with aggregate data, so people can actually see very transparent way what we're doing in the agency. And as a matter of fact,